Gout versus Pseudogout. Which joints are affected? Imagine sudden, intense joint pain that comes out of nowhere. That's what happens in gout and pseudogout, but knowing which joints are involved can help tell them apart. Gout often hits the big toe first, especially the joint at the base called the first metatarsophalangeal joint. It usually affects just one joint during an attack, but other common sites include the ankle, heel, knee, and sometimes finger joints. In men, about half of the initial gout attacks involve the big toe, while women more often experience the knee first. Gout attacks tend to involve only one joint at a time, making the pain sharp and localized. Pseudogout, on the other hand, usually affects larger joints. The knee is the most common site, followed by the wrist and the big knuckles of the hand, known as the metacarpophalangeal joints. It can also involve the hip, shoulder, elbow, ankle, and even the spine. And like gout, pseudogout rarely targets the big toe. Instead, it often involves between 1 and 4 joints at the same time, causing swelling, redness, and pain in multiple areas. The joint involvement pattern is different, which helps doctors distinguish between the two conditions. So if you suddenly experience pain in just your big toe, gout is a likely culprit. But if several larger joints like your knee, wrist, or knuckles become swollen and painful together, pseudogout might be the cause. Both conditions cause inflammation, redness, and joint discomfort, but their typical joint patterns are key clues for diagnosis. Remember, these patterns are general trends, and individual cases can vary. It's always best to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Understanding which joints are affected helps in managing flare-ups effectively and choosing the right treatment approach.